Right to go. So just up front, I've got National Cabinet at 9 o'clock, so I'll have a chat about quarantine, vaccine, our vaccine request. Martin Foley and public health officials will be out a bit later. They'll go to the numbers of the day. With Matt Cool's last questions, I need to run to National Cabinet. So if we're right to go, very pleased that the Commonwealth Government has indicated their support for Victoria's proposal for an alternative quarantine facility and to fund its construction. There have been very positive discussions with the Commonwealth all the way through, from the PM's comments early on that this was a very comprehensive policy proposal put forward by the state and would be dealt with in good faith, and that has been the nature of the discussions to date. So I'm very, very pleased that today we have reached agreement. Both the PM and I have signed a memorandum of understanding, and we're going to get cracking and deliver this facility. This is a very, very good outcome for Victorians and for all Australians. What we know with hotel quarantine is it's done a very good job, but it is not no risk. It is not a zero risk environment, never has been and never will be. And we've seen right across our nation 21 breaches in hotel quarantine. So our very strong argument has been we must have a Howard Springs-like alternative, a purpose-built quarantine facility for our highest risk individuals, and that's exactly what we will deliver. So we're now going to, as we've already got the expression of interests out, we're already doing the work on the design and planning. We'll work with the Commonwealth. This is a priority for both governments. We'll work with the Commonwealth in terms of if there's any way that we can fast-track all of the planning processes. We want to get construction happening as soon as possible. We want to get this open as soon as possible. So I'm very, very pleased that we've reached this agreement today. And I think a lot of Victorians, or most Victorians, Australians, will be very, very pleased that we've reached this outcome. The Commonwealth hasn't indicated, and we have not yet landed on exactly which site, but either one will work. Our preference is Mickleham. We are very happy to have it at the Avalon site as well. It will work equally well there, so we are entirely comfortable where it may be. What we can say definitively to all Victorians and all Australians, this will happen. It's been approved by the Commonwealth. They will fund its construction, and I'm very, very pleased at this outcome. Just before questions, the other thing I want to mention is on our vaccine request. Our health ministers, Martin Foley in Victoria, Greg Hunt federally, have been in discussions, and I'm very pleased that the federal government has indicated that it will do all it can to meet the request of Victoria. As we've seen, as we've reported on over the last week or so, we've seen a significant increase in demand for both Pfizer and for AstraZeneca. At our state centres, we're now running at around 140,000 doses per week, but demand still exceeds access, where people are having to wait weeks, where we've seen long queues. We've also seen some gaps in access, particularly in regional Victoria and in our peri-urban areas. So this morning we have made a request to the Commonwealth, a request to double the distribution, double the number of AstraZeneca to our primary caregivers, our GP network. We agree with the AMA that our GPs can do double what they are doing. So we want to see a doubling of the AstraZeneca vaccine to our GPs. We also want to see additional Pfizer allocations, starting from a further 100,000, an additional 100,000 from mid-June, and some confidence in supply for that 6-week period. So we need some ongoing confidence that that supply is coming, and I think the details are being sent around to you. But I want to say again, the discussions between the Victorian Health Minister and the Federal Health Minister have been very positive. The Federal Government has indicated they'll do all they can to ensure that that additional request from Victoria is met. So on those two outcomes, this is a good day in our fight against this virus. the green light, the definitive green light for the alternative quarantine facility, the proposal from Victoria is a very, very good thing, and I'm very pleased and I want to thank the Commonwealth. Happy to answer questions.
Acting Premier, is there any chance the lockdown will be cut short given the reclassification of the 2 fleeting cases?
Our answer on that hasn't changed, and nor should it. It is absolutely based on public health advice, and that is assessed day by day, hour by hour. The Health Minister and public health officials will be able to go into some further detail in terms of exactly where we are at today, but the proposition put forward by public health was that we needed this further 7-day period for Greater Melbourne to absolutely run this thing to the ground, and that remains the case.
That proposition was partly based on these 2 cases that have now turned out to be false positives, though. Surely when the facts change, your response changes?
Our response changes based on what is the reality on the ground, and we've got 5,000 primary close contacts, we've got exposure sites right across the state, we've got a high number of cases, many of them of some concern to public health. We have seen, it's been a feature, it's been a rare occurrence, but from hundreds of thousands of tests during this journey with the pandemic, hundreds of thousands of tests, there is the rare occasion where you get a false positive or you get a false negative. That's been the case all the way through. But there have been a number of other cases where we've seen fleeting contact and transmission, and public health will go into further detail when they're standing up with the Minister for Health later on today.
You first became aware of those false positives, because there is some inclination that it was Tuesday about the Brighton one that the department was aware that they were a false positive.
I became aware of this overnight, but in terms of the detail of those cases, and as I said, a false positive, a false negative, it's been a rare occurrence, but has been a feature. When you do hundreds of thousands of tests during the pandemic, these things happen. They've happened a number of times where Minister for Health, public health team have said, this case we thought was a positive, but it's actually a negative, or we thought it was a negative, it's actually a positive. These false cases are rare, they do happen. There's been a number of other cases in this outbreak where we've seen fleeting transmission, and public health will go through that detail later today.
Can you say how many people have now been released from quarantine as a result of those 2 false positives being announced?
Public health will go to that later today.
The ABC broadcast on Wednesday morning that the Mickleham display home woman had been told that her positive was false. How is it that you only were told about this last night?
Look, public health will go through the detail in terms of the timeline and the retesting and the examination. When you've got this. This is not, it is rare, but it's not new, and that's the point I want to make. We've seen false positives and false negatives right throughout this pandemic. A lot of testing and retesting and examination of the cases, of their circumstances, and making sure we've got the right information and do that by the retesting. In terms of the detail, public health will speak to that when they're standing up.
I get that it needs to be reviewed by an expert panel, but surely public health should have told you early on Wednesday in the case of the Mickleham case and on Tuesday in the case of the Brighton case that there was some doubt about those positives being positives.
Rachel, I appreciate your question, but you've just repeated it and I've given my answer.
Can you reassure Victorians that the state government didn't know about either of these false positives prior to the announcement of the lockdown extension?
Public health will go through the timing. The point I'm making is, you've got more than 5,000 primary close contacts, hundreds of exposure sites, a number of cases, of which a number of those are particularly concerning to public health. The advice from public health remains the same. We needed to go into lockdown to drive this variant of concern into the ground, because we cannot risk it running away from us. We can't risk it for Victorians. Indeed, we can't risk it for Australians. So the public health advice to government remains the same.
Well, you would have got last night you would have been given a situation report on how many cases have come through. How many cases were you updated on last night?
Richard, the Public Health team and the Minister for Health will go to the latest numbers when they're standing up a bit later on this morning.
Were you given an update last night?
Look, I'm constantly updated, but it's appropriate. We haven't, my understanding is the latest results haven't been released. They will be released. Public Health team will be up in a couple of hours' time. I've got National Cabinet at 9. I've been preparing for National Cabinet. So I'm talking to you now about prior to National Cabinet. The Public Health team, the Minister for Health, will be up a little bit later on today to go into the latest case numbers, exposure sites, primary close contacts, all your questions about fleeting transmission, they'll go to those in a couple of hours' time.
Can I ask you about school students, primary school students and students that are at specialist schools? We've heard from parents that say that their children are really struggling not being able to go to those specialist schools. Will the government review that to see if some year levels can go back earlier? Yeah,
look, I know this is tough on parents and carers, particularly children with additional needs and their parents and carers. I know that this is a tough time. We don't make any of these decisions lightly. I want to see all kids back at school as soon as possible. The public health advice is that right now we can have our year 11 and 12 students back at school today, and that's a great thing. I very much look forward to, as soon as we can, getting other students back. Vulnerable students, children of authorised workers are at school, and that remains the case. I'm very keen to see students back as soon as possible, but it has to be based on public health advice. In terms of support, our schools have been wonderful supporting children. We've got 6,000 additional tutors that we did not have last year, particularly supporting those students we know who struggled with remote learning in 2020. So we've got that additional support. My message to parents and carers is, I'll get your kids back at school as soon as possible.
Acting Premier, just back on vaccines, are we giving out too many first doses right now and eating into our stockpile so we can't guarantee second doses?
No, we're not. We're being very careful to make sure, particularly now we're heading into that time where people are getting their second dose of AstraZeneca. There's a quicker turnaround into a second dose for Pfizer. So we're making sure that we're not eating into that. But the demand right now is exceeding supply and is exceeding access. We agree with the AMA here in Victoria that our GPs can do double what they're doing. There's been very, very good discussions between our respective health ministers, between Victoria and the Commonwealth. The Commonwealth have indicated they'll do all they can to provide additional vaccines, and that's why we're asking for a doubling of AstraZeneca for our GPs and significant increase in Pfizer at our state sites.
Just back on the lockdown stuff, even if we don't see any change in the public health advice despite these 2 false positives, if we continue on a good track, is there a chance that restrictions will be eased more quickly than we might otherwise have thought after this 2-week lockdown?
Yeah, look, as I said when we announced the second period of lockdown, the further 7 days for Greater Melbourne, my expectation is next week I'll be in a position, based on public health advice, to announce further easings in regional Victoria and some careful easing of restrictions in Melbourne. That remains my expectation. As you heard yesterday from Professor Cheng and the day before from Professor Sutton, it's assessed day by day. If we can ease restrictions quicker, if we can go further, we always seek to do that.
At National Cabinet today, you'll discuss the COVID payment that was announced yesterday by the federal government. What's your position on how that will be paid for? Will the states take half of the cost on that?
Yeah, look, I'm pleased that the Commonwealth is providing some additional support for Victorian workers, and indeed what's before National Cabinet is that there's a nationally consistent approach in terms of if there are future lockdowns anywhere in Australia, there's an understanding of what support the Commonwealth can provide for workers. So I am pleased that the PM has announced this additional support. My view remains the same, that business support is a responsibility of the state government, income support is a responsibility of the federal government, and the PM has indicated that he's pretty comfortable either in a situation where it's 50-50 between the states and the federal government on that support, or 50-50 in the sense that the states provide business support and the federal government provides income support. That's the Victorian position. We've already announced some $460 million of business support for this lockdown, and we've indicated we'll provide additional support for regional tourism and accommodation, and I hope to make that announcement in the next little while. So pleased about the announcement by the Commonwealth. The only thing I would say is that it seems a little bit unfair to tax, for individuals to be taxed on that support, and I hope that's reconsidered. But overall, I'm pleased the Commonwealth is providing this income support, and we will provide the business support.
Is it unfair that I guess if you have $10,000 in your bank account, that you don't qualify for that, given that a lot of those retail and hospitality workers will be saving deposits for their house? So if they have if they've got a bit of money in their account, they totally miss out and they have to dip into those savings?
Look, it's true to say that there are a number of conditions for this additional support from the Commonwealth. Those are questions really you should put to the federal government. I'm pleased that there is something. I'm pleased that the Commonwealth has listened to Victorian businesses and Victorian workers that they need additional support. So I'm pleased that that something has been provided.
Will you be advocating to make vaccines mandatory for aged care workers when you go into National Cabinet?
Well, what I want to hear is the advice from AHPPC and the discussion in the room, and I'm happy to talk about it afterwards.
Just quickly, news has broken this morning that a cabinet member of staff is being investigated for allegedly bullying COVID call centre staff and others, that he made a female colleague cry and told staff that he could effing kill somebody. What's your response to that investigation?
Rachel, that's the first I've heard about that, so I don't think it's appropriate for me to speculate or guess. I appreciate that's what you're putting to me. I'll go get some advice on that.
Acting Premier, are you going to be joining the public health team later after National Cabinet for a COVID update?
It depends on the length of the National Cabinet meeting. I'm here talking to you today. I was talking to you yesterday. We'll have the Minister for Health and the public health team to answer all your questions.
Just back with the quarantine facility, you said you could do anything to speed it up.
Yep.
September was the last date. Are we looking at bringing that forward at all, or is the timeline still the same?
Yeah, so now that we've got a definitive green light from the Commonwealth, which is a wonderful thing, we'll engage with them in terms of is there any levers that we can pull in terms of Commonwealth planning processes to fast track this. I want to be absolutely clear with the people of Victoria, this is a priority of the Victorian Government and the Commonwealth Government. We'll get this done as quickly as is humanely possible. So we'll look at all levers that we've got to fast track this. Looking forward to seeing the results of the EOI. We're doing the design and planning work. We'll now work with the Commonwealth to see how we can fast track this.
How is it that a site still hasn't been determined, and how can you proceed with a lot of that planning if you don't know where you're going to be building
because we've got and we've had granted access by the Commonwealth to both sites, so we could go to both sites, and we've been doing that work already. So a lot of this. The discussions with the Commonwealth and the site investigations have been happening concurrently. So we had a few weeks ago the green light from the Commonwealth to access both the Mickleham and Avalon sites. So there'll be no delay whatsoever in the construction of this. We're happy with whatever call the Commonwealth makes, whether it's Mickleham or Avalon. We are absolutely happy, and we've got site access to both of those sites.
If it is Avalon, planes will fly direct to Avalon rather than going to Melbourne Airport?
There'll be those sorts of operational decisions will be made as we go through the construction, Rich. All right, thank you, everyone.
Thank you.